Hello, and I'm excited to have the opportunity to talk with you today about the field of public health. This presentation is going to give a brief overview of what public health is, some of the career and educational options in the field of public health, as well as the Bachelor of Science and Master of Public Health, or BSMPH, dual degree program available at the CSU campus of the Colorado School of Public Health. When talking about public health, many people immediately think of hospitals and medicine. So I like to take a couple of minutes to talk about some of the differences between healthcare and public health. When we think of traditional medicine and healthcare, it's typically a one-on-one provider-patient or provider-client interaction. The provider is focused on the issue of that one patient or client, is perhaps looking at their biochemistry or symptoms, and is looking for a diagnosis so they can develop a treatment plan. In public health, the focus is on prevention. So prevention of the illness, injury, or chronic condition that the patient is seeking help with. Public health also works at the population level as opposed to the individual level. So instead of focusing on the issue of one patient, we're developing interventions to reach an entire neighborhood, demographic, or even a country. And although we work to prevent the need for healthcare to begin with, when someone does need healthcare, we want to make sure that everyone has access to it. Healthcare and public health are both very important, and there is certainly gray area between the two. Healthcare happens in public health settings, and public health happens in healthcare settings. Additionally, public health and healthcare professionals do work together to address public health issues. So where else is public health work being done? Here are just a few examples. You may be familiar with some of these sectors, but others may be new to you. Public health work is done in the sectors of natural resources, such as environmental health and clean energy, schools and their student or employee wellness programs, recreation, such as safe hiking trails, workplace safety, transportation planning, and disease investigation, along with many others. These are some of the job titles for people working in the field of public health. The list of examples of public health career options could go on and on, but the important thing to take away from this is that the field of public health is very broad, and that public health exists in many different sectors of the workforce. A public health degree is widely applicable and offers a great amount of flexibility. So someone could be a health educator, a data analyst, a disease investigator, a policy analyst, a public health nurse, or even a wellness coordinator. The Master of Public Health degree, or MPH degree, is the most common degree for people in the field of public health. The MPH degree is considered a professional degree as opposed to an academic degree. Master of Science and Doctor of Philosophy programs are academic degrees, and they train people to do research and become an expert in a certain field or topic area. An MPH degree trains people to go work in the public health workforce. For full-time students, it's typically a 2-year degree program. Most MPH programs don't have course prerequisites, although an undergraduate statistics course can be helpful. For individuals interested in the fields of epidemiology or biostatistics, having some experience and skills in science, math, or statistics can be beneficial. But for all of the other disciplines of public health, you can really come from any major or background. We have students join our program from anthropology, psychology, exercise and nutrition backgrounds, the sciences, and even theater and communications. This results in a great diversity in our student body and students bringing different perspectives to our classes. Now that we've talked a bit about what public health is, some of the different sectors of public health, and the most common degree program for public health professionals, I'd like to share some information with you about a unique offering at CSU, which is our BS MPH dual degree program. Some of the reasons why the BSMPH degree can be attractive to students is that you receive 2 degrees, including a graduate degree, in less time than if you completed them separately. As noted earlier, the MPH degree typically takes 2 years. In the BSMPH combined degree program, students end up taking some graduate public health courses in their junior and senior years, and then apply those courses toward both degrees. So students can receive both degrees in just 5 years as opposed to 6 years. Not only does this reduce the time that you are in school, but it also reduces the tuition costs. To be eligible for the BSMPH program, you need to be enrolled in one of the listed CSU undergraduate majors or concentrations. You will apply to the BSMPH program in your sophomore or junior year so that you have at least 1 full academic year left after being offered admission. And you need to have a cumulative GPA of at least 3.3. The application completion date is January 15th. You submit your application in an online system called Sophis, and it can take them up to 4 weeks to process an application. So you want to plan ahead and try to have all of your application materials submitted by mid-December so that your application is reviewable by January 15th, not just submitted. Applicants will be informed of an admissions decision by March 1. You can find detailed instructions for the BSMPH application, including some specific pieces of information to include in your essay on our CSU Public Health website, which is publichealth.colostate.edu. As previously mentioned, you will submit your application to the Colorado School of Public Health through the online Sophis application portal. Your application needs to include your official transcripts, a resume or CV, your essay or personal statement, and 3 letters of recommendation. One of your references should either be an academic success coordinator or an assigned faculty advisor. Your other references can also be professors, but they could also be a supervisor for a place where you worked, someone from an organization where you volunteer, or even a mentor. I hope that through this presentation, you've been able to see how your own interests might align with the field of public health. If you have any questions about the BSMPH program and application requirements, the MPH program by itself, or even just the field of public health, please reach out to Kendra Bigsby, Assistant Director for the CSU campus of the Colorado School of Public Health. She is the primary contact for prospective students and can answer your questions over email or set up appointments over the phone or Zoom to talk more about your specific interests. Thank you so much for your time today, and we hope to have a chance to work with you soon.